You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, sedation dentistry. According to my first guest, there are so many people in Kentucky, and Paducah in particular, that their fear of the dentist is keeping them from having the smile they always wanted. In fact, he says that people are even living in pain, but their fear of the dentist keeps them away. And he says sedation is the answer. They'll even prescribe a pill the night before so you can sleep, get a ride in the morning. And he says you take either IV sedation or a pill, you could have many months worth of dentistry all in one visit. The other group of people, he says, are the type A or busy people, or a mother that has 3 children, doesn't have time to go back and forth to the dentist. And they can do it with sedation, allows you to be there a longer period of time and get more dental work done. With us, we have sedation dentist, Kentucky sedation dentist, Dr. Mangino. Dr. Mangino, welcome to the program.
How are you doing? Good, glad to be here.
Good. Now, for people that don't know your practice,
Yeah.
I guess you do a lot of just about everything. You have this concept where you do everything under one roof.
That's right.
Tell me about that.
Yeah, we try to keep everything in-house. We do everything from whitenings, cleanings. For people with loose teeth, we're able to do gum treatment and make those teeth tight again.
Okay.
We have adult orthodontics. It's more of a cosmetic orthodontics, and we're able to put the braces on, and then 6 months later, you're able to have straight teeth.
Yeah,
It's
you
called
call this 6 month smiles.
That's right.
Is that right? Like invisible braces.
Yeah, and it really does amazing work to straighten your front teeth.
Okay.
And people are, if they have crooked teeth, are sometimes a little paranoid about it. This will take care of it.
So you even do like your own root canals and wisdom teeth.
Root canals,
All right,
wisdom
there.
teeth. We take teeth out every day. I mean, we can do. We can even take teeth out and put implants in the same day. We do grafting. We pretty much can almost do it all.
Do it all right there.
do it all.
Now, you know, some of the slang words, you know, super specialist, because you have a lot. In fact, you called yourself a dental nerd. We've had Dr. Walden on the show talking about mini dental implants.
That's right.
But he says you guys are always going to courses.
All the time.
Is there that much to learn?
Well, dental school teaches you kind of the cookbook of dentistry. To take that next leap and to, I guess, better serve your patients, you have to do continuing education. And we go all across the country. And not only do, like my partner, Dr. Walden and me, but we also take our staff, so they're highly trained too. And that's very important for a sedation office, because when a patient comes in, our staff is able to recognize their fears, and they're able to kind of assist them in ways that other offices maybe can't.
Now this is something I didn't know, and many people don't know, that I guess less than 5% of general dentists in the U.S. have a sedation license to do oral conscious sedation or IV sedation.
Yeah.
Is that right? Why'd you choose to do it?
Well,
Because you kind of love it. I should mention it. We talked
do.
to the phone.
It just makes it, not only do I love it, but our patients love it. It just, to me, if you do not sedate patients, or you don't give them a choice of sedation, then you're really not serving them right, because there are so many people. I think I saw in a survey that said 50 to 70% of people have some type of dental fear. So that's about 40 million Americans are absolutely phobic and scared to death to go to
Is that
the
right?
dentist
Do you see these phobic type people?
every day, and they're scared to death. I mean,
There's really people that afraid of the dentist?
Yeah, these are the people that will pick up the phone and almost want to make an appointment, but they put the phone down.
They tell you they did this? Like
Yes.
they hung up a few times?
They hung up. Or they'll come to the office, or they'll try to do whatever they can to skip an appointment. And the phobic, it's different than anxiety. This is truly terrified. There's an unreasonable fear. And then from there, we also see a lot of the busy and the people with type A personalities, the people that are on the go, maybe the CEO of a company or something.
Like they neglected their teeth because of the hassle associated with the dentist.
The busy mom or whoever, yes. So sedation can...
Because I guess it's hard to lay there with your mouth open for a long time.
Yes.
So if you're sedated, because I told you, I have zero fear of the dentist, but I hate going to the dentist.
My mother, who, she's not even fearful of the dentist, but we did a gum treatment on her. And it's just a long time to lay there for 4 or 5 hours. And we get in there and clean all the teeth out. But she just did it just to relax.
So deep cleanings under oral sedation.
We do it all the time.
You just take a pill to relax.
Relax.
Now, I haven't done that one, but I've done the nitrous. You do the nitrous oxide?
We do.
It's like relaxing.
It is. It will, what we do is we turn the gas on and you lay there, and then when the procedure's over, you're relaxed and it's kind of tingly feeling, and
it's like you come right out of it, don't you?
We put the oxygen straight on, and you're able to leave our office, and you're actually able, from the nitrous, you're able to drive home after that. We wait about 15, 20 minutes before that.
And, so sedation dentistry is kind of, I mean, I guess where you are, you're known as a sedation dentist. People travel to see you for
hundreds
this?
of miles. Hundreds
Really?
of miles. We've been doing sedation for about over 20 years now. We were one of the first offices, well, probably the first office in Paducah to do sedation. It's what we're known for. People seek us out for sedation, and they will travel from, say, Hopkinsville, from Marion, I mean, all over, and for sedation. And we see it every day.
And so now in your practice, we've had Dr. Walden on the show talking about mini dental implants to stabilize denture or replace missing teeth with mini dental implants. Do you do kind of the same things? Is there overlap?
Yeah, we both do.
What's your role? What's his role?
Actually, we both do the same thing. We're both trained in all areas. He's done a lot of courses as well as me. So we're able to, either one of us are able to handle whatever comes our way.
Now, normally sedation is handled by, I guess, by the oral surgeon or the specialist, the periodontist. And so as a general dentist, I guess it's easier on the patient. They don't have to be sent out.
Exactly.
Is that right?
Yeah, we try to keep them so it's convenient for them. Now we do use specialists every once in a while, and there are times when you need to use, but for the most part, we try to keep everything in-house to make it easy on the patient. So, because a lot of these patients are coming from miles away, I mean, hundreds of miles, 50 miles, whatever it may be, and that's the last thing you want to do is say, go here, go there. So they're able to do most things all in-house.
So is this one of your more popular procedures? Like once you get a procedure under sedation, you're like hooked? Like everything, like cleaning?
Once you're in the know and you have sedation, I mean, a lot of our patients will always keep on doing sedation, but the strange thing is that, so these people who come in and they're scared and they want sedation, it seems like over time we almost reverse them though.
What do you mean by that?
That means like for instance, I have a lady that she came in for cleanings and she was so scared she had to be sedated for cleanings. Her mouth is great, but she was just that scared. Well now, over time, she's able to not only not use sedation anymore, I mean, she is like a changed lady. And I mean, she comes in every 6 months, her teeth look great, and she doesn't even have to sedate anymore.
Just that fear is completely gone.
It's gone.
So for the bigger procedures, like when somebody comes in with, because your office, somebody can walk in with no teeth on the day of the procedure and walk out with a full arch of teeth, upper and lower, secured by dental implants. These people obviously have to be sedated?
They don't have to, but yeah, if it was me, I would be sedated for it.
Is that right?
Because it's a long day. I mean, you're there 7 in the morning, and then from there, I mean, if you have teeth taken out or you're having implants placed, it's just a long day, and it just makes it easy on them. And on top of that, they won't remember really much of anything. Now, they're still conscious. I want them to respond, but at the same time, I always tell people it's almost like if whenever they get sedation done, it's almost like you're in bed, and in the middle of the night, I shake you and say, "What time is it?" And you'll look, and the next morning you're like, "Well, I think I got up around 3 or 4." It's kind of hazy.
Yeah.
It's the same thing with sedation. I mean, they'll get the procedure. I'll say open. They might say, "Hey," they'll open, but the next day when I talk to them, they don't
remember anything.
They might be like, "Well, I kind of remember something," but they don't.
You told me that
amnesic.
One patient called, they thought they missed their appointment.
I thought they missed it.
Can that really be true?
They have. It's amazing. I mean, sometimes it's with sedation. It's amazing that people, when you call them at night, they don't remember really much of anything at all. Now, the lady who did call that forgot her appointment, we had to almost bring her back in and say, "Hey, actually, your work was done. Trust me." I mean,
so she couldn't even believe. So it must have been something in the back of her mouth.
Yeah,
so she couldn't see it. So she didn't even believe it.
Yeah. So
that's good news, especially if you don't like going to the dentist.
Exactly.
Who likes it the most, the phobics or the people that are so busy and they just don't like going to the dentist? Based on your experience.
I mean, it's hard to say really. I mean, sedation serves equally as well. I mean, I guess more or less for the people who are on the run, it's just convenient. It's just a convenient way to do dentistry for them.
Okay.
It's like they can come in, stop, get the dentistry done, go on with the rest of their life or their day or whatever it may be. Now, for the phobic, I mean, they're completely terrified. I mean, shaking, sweats, barely want to come to the office. And for them, when you sedate them, to me, it's more rewarding in ways for them because they're doing something, like for instance, I don't like heights. I really don't like it.
Afraid of heights.
So I get up there, I get sweaty palms. I mean, I understand where they're coming from. And then when I get down, I'm like relieved. Well, I'm sure they're the same way when they're coming to our office, they get dental work, and then afterwards, they're relieved. I mean, that to me is rewarding that they're able to overcome a fear, and we're able to do it with sedation.
Is sedation more for the younger patients, they're requesting it, or patients in their 70s and 80s?
All age ranges can sedate. Just recently, I had a lady that was close to probably she's near 80. She had full mouth teeth, but they were in bad shape. So she got tired of her teeth with the smell, and she had perio disease, and she just wasn't happy.
Okay.
She couldn't eat almost anything. So what we had to do is under sedation, we were able to remove her teeth. We were able to put in the implants, and then we were able to take a denture and give her a whole new set of teeth because they snap into place.
Okay.
Now, the amazing part is when I saw her, when we were able, after we put the dentures in and snapped them into place, she came back the next day, and it's the first time in years she ate salad. I mean, to us, salad, I mean, she could chew, and she said, that was the first time. She literally cried in our office. It almost makes you cry, but she was able to eat what she wanted to eat. Not what she was so used to going to a restaurant and ordering something off the menu that she knew that maybe a milkshake or something she could eat, but now she can eat what she wants.
You know, I've had dentists on this show, and by the way, like I told you, I don't have a fear of the dentist. And people need to know, this is a real interview. I'm not endorsing you, I'm just asking the questions, but sedation is one of those things I'm sold on. Mm-hmm. Because I put off going to the dentist, and once I got the nitrous, for me it was just nitrous, now I look forward to my appointment, and I was having a deep cleaning one day, and I was bummed that it was over. And they like turned it off, and I was back to normal like in seconds.
Yeah.
But I had a dentist on the show, and he said, Randy, my patients don't need sedation because we have I have a good bedside manner. And to me, I was thinking, that's got to be insensitive. I don't think they get how bad of an experience it is have to go to the dentist.
That's right. Do
you feel it's insensitive? I don't want to put words in your mouth.
Well, I just feel like you could almost try every trick in the book. I mean, you can sit there, but ultimately, if they're truly phobic or fearful, I mean, the only way they're going to be able to make it through is with sedation. So,
but even for not even the fearful, like I'm not afraid of the dentist, but you're there, you could hear the scraping, you could hear these things, and that even just the nitrous just makes it such a pleasurable experience.
Yes.
Like you don't care about those things.
Yeah, and that's true. I mean, most people don't like to go to the dentist. I don't even like to sit in the dental chair as well.
You don't either?
No, I mean, if I go to the dentist, I don't get sedated. I manage to get through it, but at the same time, if I could be sedated, I mean, it'd make it a lot easier.
If you had to have a big procedure.
If I had a big procedure, I would myself get sedated. There are so many people out there across the country or even Paducah or wherever that just who don't like their smile. It could be because they
just don't like them.
They don't. And
so they never smile?
Yeah, I mean, they don't smile.
Okay.
So a smile is everything.
Really? Now, that doesn't surprise me. You're a dentist. Of course, you think the smile is important. So how important do you think it is?
I just read in Men's Fitness in a survey that's what people find physically attractive in others. And a smile was in the top 3 in the survey.
Okay.
There's other surveys out there, but a smile, it could be hair, eyes, whatever, but a smile is always the top one.
That's true. I agree with that.
Always. I mean, it's a very intimate part of your body. People, I mean, just for instance, if there were some twins going into an interview and they had the same stats.
Okay.
Same education, going for the same job. But the one who comes smiling from ear to ear walks in, interviews, goes. Then the other one walks in and serious and doesn't crack a smile at all. The one who smiles is going to get the job.
I believe that's true. Because the one that, obviously you hire the one that looks positive.
That's what you want.
Enthusiastic.
Exactly.
Not so much the one with the prettier smile, but if one is smiling, one isn't. Obviously, the one smiling.
I even saw a thing that said, for instance, you talk about getting a job, like Al Gore, if he smiled more, he would have won an election.
That's right. He was known as kind of a dud.
He is.
Right.
Was, yes.
You know, Jimmy Carter, since you brought up presidents, they said he won the election because of his smile.
Yeah.
He could always smile and talk.
Yeah.
So there's a lot of people in Paducah. You're going to wipe that out. So don't let, we said this at the top of the show. Don't let your fear of the dentist or your busy schedule keep you from having the smile you've always wanted.
That's right.
You believe that to your core.
Yes. Don't let the fear of the dentist keep you from come seeing us. With sedation, we're able to take care of you. Leave your worries at home. With sedation, I mean, those days are over of you sitting around in pain, or you maybe have sweats or something the night before or can't sleep. I mean, with sedation, we're able to take all that away, and you just can relax.
And you say that people think that they're alone, like they're the only ones that feel this way.
Yeah,
that's common.
That's common. But if you sat in our waiting room every day, you'd see a room full of people that are nervous, scared, and they just almost just want to get it over with.
And I think it's worth mentioning, I think you said that in most cases, or almost in every case, you include in the oral sedation. You throw it in.
We do, because I don't want that to be a roadblock or a barrier for people who are that scared to get treatment done. It makes it easier on them. It makes it easier on me.
Must be easy. Isn't it easier on the dentist because they're relaxed?
Oh yeah.
Their blood pressure's probably lower. Is that true? Is there any truth to that?
Definitely. I mean, when they're sedated, we can see what their heart rate is. We're able to check their pulse. We can see what their breathing's like. At the same time, they're not sitting there moving around, and they're just laying there. And it makes it easier and less stressful even on me and my assistants. So
when they're doing, do they say some silly things probably here and there?
Usually I think the biggest thing they're worried about is if they snored. So
is that right?
So afterwards they always like, "Dad, snore bad?" And it's just, and I'll say, "Oh my God, you're so loud," but I'm just joking with them. I mean, it's they're usually snoozing, so it's fine. And like I said earlier, with sedation, it makes it easier on everybody.
So the busy people, okay, so like the moms that don't want to drive back and forth, they can't, right? They can't, drive back and forth all the time. We should mention, and we mentioned a little bit of it, but you guys do pretty much everything.
Everything.
Like you do things like what an endodontist would do. You do root canals, you do wisdom teeth.
Yeah, I mean
braces, veneers, dental implants.
Yeah, I had a guy who he's a busy man. He travels about, I'd say 50 miles, 40 miles or so, but he's on the go. He's busy, and he runs a successful company. So we sedated him just so he could he had a lot of wear on his teeth, so he needed some crowns and other root canals, and I think he even whitened his teeth. But anyhow, he came in just to sedate, to do all that, and then he's able to go about his day and his busy life, and he's back to normal.
Now you do these ultra thin veneers. What does that mean? Ultra thin veneers.
They're called Durathin veneers.
Durathin, okay.
Mm-hmm. And we're able to actually put the veneers on top of your teeth. Now there's certain cases where,
so like if you have small teeth,
we're able to put them right on top. We don't have to shave down your teeth or anything like that. And we're able to put them on, and it look like real teeth.
Beautiful smile.
Beautiful.
And are those people, are veneer cases getting sedation or no?
Yes, you could do it under sedation.
Are they requesting this because you guys have a reputation? Is this something they're requesting nowadays, or are you saying, "Hey, have you considered?" I mean,
most people in our area seek us out for sedation. I mean, they know about us, so they're coming to us specifically, usually for sedation. Now, we don't only do sedation. I mean, if you don't want to be sedated, we see a lot of patients who don't want to be sedated. But yes, we do see a large number of people who need sedation, and it just makes it easy on them.
Well, if I was running your practice, I would make sure everybody gets sedation. I'm joking around, because I think it makes it just easier. It's more pleasant.
Yeah.
You take something that's not fun to do and you turn it into kind of a fun thing to do.
Mm-hmm.
I don't want to simplify it, but it is that way.
It makes it fun on everybody too. I mean, we have a good time, and I mean, they can relax, and then that's it.
So you brought some photos. What are we looking at here? Now, these were all sedation patients, and I'm going to paraphrase you slightly, but before you said I brought photos of people that they wouldn't have even had their teeth fixed if it weren't for sedation.
Yeah.
So, oh my goodness.
That's Will. He was a quiet guy, very quiet. When he first came to our office, he would hardly say a word. I didn't know if he was mad at me or he just would not speak. And to get him to open that much, I mean, he was just embarrassed. But
That's got to be unusual. Is that unusual?
No, it's not. I mean, you would think it's unusual, but most people don't see it because these people are keeping their mouth closed. So it's very common.
Oh.
It's so common. I mean, I see this on a daily basis. These people, like this guy, I mean, he's in pain. He's got perio disease. I mean, so there's smell. I mean, he's embarrassed. He can't function. He can't chew. He can't eat.
So what'd you do for him?
So in his case, we had the teeth taken out. We sedated him. And then we were able to put implants in, and then we snapped in a cosmetic denture where he came back, and now this guy he's the jokester of the office. I mean,
Is that right?
Now from the picture you can tell he doesn't really know how to smile yet, and he even told me I can't even remember how to smile. So that will take some time, but he's able to eat. He's able to go do what he wants. He's blossoming into a new person. He's back.
Yeah.
He is back.
Yeah, yeah. Now, what about this other photo?
So this other photo was someone who very, very, very scared. I mean, words beyond scared. Sitting in the chair, they came in, they're shaking. I mean, just literally shaking. To get their attention, she's just very, very, it's one of the most terrified persons I've ever seen in my life.
Okay.
And it took her a lot to get there to our office. I mean, this has been going on. She's in pain. Teeth are breaking. From the x-ray, or from the picture, it's hard to see, but these teeth aren't savable.
So you could not save those teeth?
I could not. They were a lot of very loose periodontal disease. They're just in bad shape.
So what did you do for her?
So what we did is we were able to sedate her, get the teeth out, and now she's wearing a cosmetic denture. And
That's a pretty smile.
Very pretty.
So
she's
a denture.
Pretty girl.
This is what a cosmetic denture
Very
looks
pretty
like.
girl. Yes.
Looks like real teeth.
Looks great. I mean, she's a changed person. She's able to smile. She's not embarrassed anymore. She's happy she's not in pain. I wish I could have met her 15 years ago, because we could have saved those teeth. We could have helped her then. And on top of that, we could have taken her fear away back then. But she sat there for, who knows, 10, 15 years, scared to death, scared to come to the dentist. And all we had to do was sedation. So we could have saved her. I mean, saved those teeth.
Do you ever have other dentists, general dentists, that don't do sedation for sending you patients?
Yeah, it happens all the time. We have, actually I had one not too long ago that just actually past week, a dentist who sent him because the patient needed a root canal, and she couldn't think of, or did not want to be able to go through that procedure without being sedated. So yeah, we're kind of like the dumping ground for all across our area. They'll send them to us to do whatever dental procedure if possible.
Now, most people have been going to their dentist for years. So, for example, in Paducah, you love your general dentist, but if you need a root canal or wisdom teeth or you need like adult orthodontist, and you're, afraid of the dentist, you can get the sedation with you and then go back to your general dentist. You stay with your general dentist to do all the cleanings and everything else.
Most certainly can.
Okay.
And when they come see us, we can sedate them. If they want to go back to their dentist, fine. I just happy they're able to get something done that they had a fear of, and now they can move on.
So sedation dentistry.
Sedation's the way to do it.
You love it. And so you do orthodontics there, you do root canals, you do wisdom teeth.
Yeah.
All of these things can be done.
Try to do it all in the house.
Under sedation. Is sedation more for the younger patients, they're requesting it, or patients in their 70s and 80s?
All age ranges can sedate. Just recently I had a lady that was close to probably she's near 80. She had full mouth teeth, but they were in bad shape. So she got tired of her teeth with the smell, and she had perio disease, and she just wasn't happy.
Okay.
She couldn't eat almost anything. So what we had to do is under sedation, we were able to remove her teeth. We were able to put in the implants, and then we were able to take a denture and give her a whole new set of teeth because they snapped into place.
Okay.
Now, the amazing part is when I saw her, when we were able, after we put the dentures in and snapped them into place, she came back the next day and It's the first time in years she ate salad. I mean, to us, salad, I mean, she could chew, and she said, that was the first time. She literally cried in our office. It almost makes you cry. But she was able to eat what she wanted to eat, not what she was so used to going to a restaurant and ordering something off the menu that she knew that maybe a milkshake or something she could eat, but now she can eat what she wants.
Okay, we are out of time. Final message to somebody that either they're afraid of the dentist, and that's why their teeth are in bad shape, or they're just have excuses. They're busy. Plus, they don't like going to the nobody likes going to the dentist.
Yeah.
What do you say to them in regard to sedation?
I would just tell them, don't let your fear keep you from the dentist. At our office with sedation, we can take care of you. We're able just come in, and we're able to.
So you're used to this in a way.
We see it every day.
Because it seems like it'd be embarrassing. Like, oh my goodness, I'm so afraid of the dentist.
People who high fear or on the run or whatever, you're able to come in, take some medication, take a little pill. The next day you're on with your life.
You're done.
That's it. That's how easy it is.
And you know, you told me that certain people that were initially dental phobics or hated going to the dentist, that after they do it a couple times with sedation, now they're no longer afraid.
That's right.
Have you ever had anybody that you no longer have to give them anything?
That has happened. For instance, earlier I was telling you about the guy who came in with the real tall guy. Well, now he comes in every 6 months and doesn't even need sedation anymore. So you reverse these people. Okay. With time, they change.
All right. I want to thank you for coming on the show.
Yeah, thank you.
Good stuff. And free consultation if they want to come in.
Free consultation.
They get to meet with you.
Yeah.
And we should mention your brother's also a dentist.
He is.
So they have to.
We're actually twins.
Oh, you're twins.
Twin
right?
brothers. So we look very close. Very like.
So they should ask for, especially if they want sedation, Dr. Matthew Mangino. Yes. Is that correct?
Yeah.
Okay, good. I want to thank you for coming on the show. Good stuff. You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.